This morning on Today's Family, are some women in love with being pregnant? In 2007, more than 4.3 million babies were born in the United States. That's the highest number ever. And more than 25% of them were to a mother's third or fourth child. The phenomenon is the focus of the August issue of Women's Health magazine, and Michelle Promaleko is the editor-in-chief, and she's also joined by Dr. Shari Luskin, who's the director of reproductive psychiatry at New York University Medical Center. Good morning to you both.
Hi. Good morning.
Okay, so Michelle, your magazine looked into these numbers, and what did you find in terms of explaining why so many babies are being born now?
Well, it's really, big families are having a moment right now. It's very much in the zeitgeist. So we decided to look at some of the factors that cause women to reproduce in such quick succession.
Mm-hmm. And you talked to psychologists primarily.
We talked to psychologists, anthropologists, MDs.
And what was your finding?
That there is sort of an addictive quality to being pregnant. A lot of great things happen, both physiologically and psychologically, that would drive a woman to keep doing this.
Mm-hmm. Drive a woman to keep doing this. I mean, the thing about it is a part of it is maybe I'm one of 5 kids, that mothers just may want to have big families and fathers as well. And there's a whole history in America of big families. But at what point are we concerned about this?
I think we're concerned about it when women are doing it to the exclusion of the other factors in their life. In other words, that drive to become pregnant just supersedes everything else. Almost like Species, you know, that movie. So if a woman thinks that having a baby is going to cure all her problems, that's a problem.
So what kind of problems did you find from your investigation that women were trying to cure, Michelle?
Well, I mean, culturally, it's like we very much put the spotlight on pregnant women. If you're trying to recapture that adoration, obviously you're not expanding your family for the right reasons.
So you're saying that people are becoming pregnant because they feel lonely and don't have enough adoration in their own...
Absolutely. They are literally filling a void in their life.
Is there also a hormonal reason that might explain why women love being pregnant? Because, I mean, I got to tell you, I love being pregnant. It was enjoyable. I love being able to eat everything I wanted to. I love the baby, you know, having the baby within me. I mean, it was all that was terrific. But is there a physiological
You hit on something very specific there, which was some of the women that Women's Health spoke to said they were liberated for the first time from diets. They could embrace their curves and feel sexy.
Mm-hmm. Yeah, I think in the best of circumstances, pregnancy is an incredible experience. You're supposed to feel good.
Yeah.
You know, in contrast, though, if you don't feel good, it's that much more awful. Mm-hmm. And what happens to some women, in contrast to the bumpaholics, is that they feel terrible during the pregnancy, and when everybody else around them is excited and thrilled and they don't feel that way, they feel guilty and they hate being pregnant.
Right.
Now, sometimes these women go on to have a postpartum depression, and then they think that getting pregnant might actually cure that postpartum depression, which is a real mistake. You know, if you're depressed before you get pregnant, you're going to be depressed during the pregnancy.
So, but there are hormonal reasons that we enjoyed while we were pregnant that we may want again, and use this phrase kind of derisively, the bumpaholic. So you're talking about when someone really needs to come in for some care, to think about why they're becoming pregnant before they actually do.
There's absolutely an addictive quality to it, and there's a withdrawal quality to it. So in that way, it is sort of like a drug. A baby love drug, one of our experts says.
This has got to be a very rare thing. I can't imagine this is a pervasive issue.
I don't think it's that rare. I don't want to medicalize everybody who wants to have another child. I mean, there are many reasons to have more children, and it's not for us to say what the right number of kids is for a particular family. I do want to emphasize that, hormones aside, because the oxytocin and estrogen definitely make you feel good, usually. So hormones aside, you know, it's a family decision as to how many kids you have.
Good point. Shari Luskin, Michelle Promaleko, thank you so much.
Thank you.